Greetings, Patriots. Welcome back to the Progressive Playbook. I'm your humble dealer, and last time we talked about the 6 crippling myths of American politics. And one thing you heard me say a lot is that we'll focus on principles over labels. Why? Because labels are intentionally used to manipulate and divide people. But when you're deeply tuned into your beliefs, you can look at any issue with confidence. Like, this goes against my beliefs, I stand against it, or this satisfies my beliefs, I'm for it. I do believe people have a lot of overlapping core values, and when you can connect with somebody on your shared values, it becomes much easier to work with people and convince them of your ideas. Here in this video, we'll be laying out our core beliefs behind the health core, which is concerned with the status and well-being of the people. I'm going to share with you my 3 deeply held beliefs about health, and regardless of your political leanings, I'm willing to bet we'll be able to connect on a lot of these. My first belief is that health is wealth. Because when we are healthy, we can live our fullest lives, and each of our other cores benefits from a strong health core. We have the ability to learn and grow, tend to our responsibilities, contribute to society, to engage with the community, and generally have a peaceful and joyful life. Conversely, when we're not well, we can't do much of anything. The flu or COVID will take you out for days, sports injuries can take you out for weeks and months, and big chronic illnesses like cancer, diabetes, or heart disease can take away years of quality time we have on this earth. In a future video, I'll touch on some of the systemic hurdles that prevent healthy living, but for this video, I'd like to focus on the second belief, which is I believe healthcare is a human right. As critical as food, water, and shelter, regardless of culture, religion, race, or economic status, no matter how well we take care of ourselves, not one of us is immune to ailment or injury. Alright, except for maybe this dude who injects himself with snake venom. The big problem is around 26 million Americans, or 8 to 10% of the population, are still uninsured or underinsured, resulting in tens of thousands of deaths per year. For many, health insurance is just too expensive. Most Americans are living paycheck to paycheck. Then something catastrophic happens and BAM! Find themselves in medical debt, which is the top cause of individual bankruptcies. Over 40% of Americans are grappling with medical debt of some kind, which totals roughly $88 billion. Not to mention, things got even worse during the pandemic when nearly 1 in 3 Americans were skipping medical care because they just couldn't afford it. We are all susceptible to various illnesses, from the common cold and the flu to cancer and depression. These can be devastating to our minds and bodies, but they shouldn't be devastating to our wallets. If we're serious about healthcare being a human right, then healthcare is not a commodity. This means not a single one of us should be denied access to healthcare because we can't afford it. Civil rights attorney Mary Gorsuch aptly points out that in the US, we have a health insurance system, not a health care system. It's a system designed to deny and profit off sickness rather than promote and support health. Take this example of Rebecca Hall, who couldn't pay for her care, and the hospital was like, "Well, sucks to be you," and just dumped her on the streets of a freezing cold night with nothing but a hospital gown. Oh, but don't worry, they apologized for it later. Even wilder are the cases where people with insurance get screwed over anyway, like the case of Jessica Pell, who was charged nearly $6,000 for a bandage and an ice pack, or Scott Cohen, who went to the emergency room for a broken jaw. He went to an in-network hospital, but was charged nearly $8,000 anyway because the surgeon who happened to operate on him was not in his network. Now, both of these charges were eventually dropped, but this isn't something people should have to deal with. Sarah Cliff, a reporter at Vox, collected 1,300 of these wild hospital stories over half a year. Link in the description. My favorite analogy for illustrating how nuts this is comes from Kyle Klinsky of Secular Talk.
If somebody knocked on your door and said, "I'm selling fire insurance, and here's a list of what can get covered," and they give you plans. "Oh, if your living room catches fire, we're going to come put that out, but not if it's your kitchen. If your bedroom catches fire, we'll put that out. But your basement? No, that's not covered in this plan." If somebody did that, you'd be like, "Are you insane?"
Right? And as insane as that sounds, that's what the rest of the developed world thinks about our healthcare system. Just as if you see a fire, you put it out, in their systems, if you get sick, you get help. If you get injured, you get help, free at the point of service. I'm now going to touch on my third belief, which is that health shouldn't be expensive. Most people might be inclined to think, well, yeah, if you cover everybody, it's a moral thing to do, but of course that means it's going to cost more for society. How are we going to pay for it? Well, I'm here to tell you the exact opposite is true, and this is where things get really exciting. A recent Yale study found that Had we had universal healthcare during the pandemic, we would have saved over 335,000 lives, but we would also be saving nearly $500 billion per year, even in non-pandemic times. There are now so many studies also saying we would save so much money by switching to a more efficient system, and we'll cover it in greater detail in a future video. Okay, to summarize, my 3 beliefs again are: 1. Health is wealth. 2. Healthcare is a human right. And 3. Health should not be expensive. Tying these 3 beliefs together, my vision for America is that the vast majority of people would be living their happiest, healthiest lives, more free from economic distress, pollution, or chronic illnesses. And if people happen to get sick or injured, they will receive help, and Americans will spend less money on healthcare costs in the long run. It's as simple as that, and it's far from a pipe dream. This is the reality in other parts of the world. So in the next video, let's draw inspiration from other nations and how they've built their healthcare systems. But I want to hear from you. What do you believe about health? Do my 3 beliefs resonate with you, or is there something you'd like to change or add? Feel free to comment below. And if you like this video, check out a few more. And if you trust my voice on this platform, consider giving me a hit of that sweet LSV, like, subscribe, and bell, and I'll deal ya the next one.